What is wound healing? Wound healing is the process by which tissue restoration of structure and function occurs, with restitution of tissue integrity and tensile strength. How does a wound heal? Wound healing can be classified into healing by primary intention, secondary intention, granulation, delayed primary, tertiary intention. Wounds can heal by resolution, no scar, or by organization and repair, invariably results in scar tissue. The stages of wound healing include hemostasis, coagulation, acute inflammation, formation of granulation tissue, endothelial cells, fibroblasts, macrophages, angiogenesis, epithelialization, fibroplasia, wound contraction, fibroblasts to myofibroblasts, maturation and remodeling. What factors affect wound healing? Factors affecting wound healing. Local factors: poor blood supply, hematoma, infection, foreign bodies, surgical technique, excessive wound tension, type of suture material, etc. Radiotherapy. General, systemic factors: diabetes, mellitus, steroids, immunodeficiency, heart failure, renal failure, liver failure, hypoxia, malnutrition, chemotherapy, malignancy. What is the key difference between hypertrophic and keloid scarring? In a hypertrophic scar, the scar is confined to the wound margins. They often occur across flexor surfaces and skin creases. In a keloid scar, the scar extends beyond the wound margins. Keloid scars are more common in patients of Black and Hispanic descent and characteristically occur in the earlobe, chin, neck, shoulder, chest, and deltoid regions. For more MRCS Part B resources, please visit mrcsbytes.com.